The esophageal silhouette, as such, it resembles an hourglass. When it resembles an hourglass, you will be experiencing that it has three distinct areas of narrowing with two dilatations in between. The three narrowest zones are: one, the first zone is the superior most portion of the hourglass, which is also the narrowest portion of the entire gastrointestinal tract, and that is composed of the first anatomical narrowing, which is about 14 mm. The second narrowing is just below the carina, where you got the broncho-aortic constriction, that is at the left main stem bronchus. This is at the level of T4, and the diameter of the esophagus is 15 to 17 mm in diameter. The third constriction is the diaphragmatic constriction, where the diameter is around 16 to 19 mm, and this is at the level of T11. It marks the inferior portion of the hourglass. With three areas of narrowing, the two areas of dilatation are the one, superior dilatation, two, the inferior dilatation. There, the esophagus regains its normal diameter and it is of around 2.5 centimeter in diameter. Now, to be specific, both upper esophageal sphincter and the lower esophageal sphincter, they are not anatomically identifiable, or that is, it is difficult to identify anatomically these structures, but they can be identified manometrically because both these are the high pressure zones. The upper esophageal sphincter is nothing but, we already saw, it is the cricopharyngeus muscle. It is of length 4 to 5 centimeter, and it is in a constant state of tone of around 60 mm mercury. Now, coming to the lower esophageal sphincter, this is also a high pressure zone, and it is of around 24 millimeter mercury, and there are certain points which mark the lower esophageal sphincter. There are some external landmarks to it, and there are some internal landmarks which can be identified with endoscopically the LES zone. Now, coming to one by one, the upper esophageal sphincter, the length, as we have already seen, it is of 4 to 5 centimeter, and the resting pressure is 60 millimeter mercury with the relaxation time of 0.558 second. The residual pressure of the upper esophageal sphincter is 0.7 to 3.7 millimeter mercury. Now, when it contracts, it sends the contractions, that is the peristalsis, at an amplitude of 40 to 80 millimeter mercury at a duration of 2.3 to 3.6 seconds. Now, coming to this lower esophageal sphincter, which is very important, the lower esophageal sphincter is of around 3 to 5 centimeter, and the abdominal length of the esophagus is around 2 to 4 centimeter. The resting pressure of the lower esophageal sphincter is around somewhere between 6 to 26 millimeter, and the mean is 24 millimeter mercury, and the relaxation time of LES is around 8 seconds. The residual pressure being 3 millimeter mercury. Now, I always said, how do you identify the lower esophageal sphincter? So, we have got some landmarks, both external landmarks as well as the endoscopical landmarks. Very important from an MCQ point of view. They will ask, and they'll give an option which is not the LES, which does not correspond the LES part. So, we will see the anatomical points which correspond to the LES. Endoscopically, the Z line, nothing but the squamo-columnar junction, corresponds to the lower esophageal sphincter, and the transition of the smooth esophagus lining to the gastric folds is the second endoscopical landmark which will identify the lower esophageal sphincter. Now, these are the internal landmarks, that is the endoscopical landmarks. Now, coming to the external landmarks, we have already seen the collar of Helvetius or the loop of Willis, where the circular muscular fibers turn or transition into the oblique sling fibers of the stomach, and that point is called the collar of Helvetius, and it is nothing but the loop of Willis, and this serves as a landmark for the LES. The other external landmark is the gastroesophageal fat pad, which also corresponds to the lower esophageal sphincter. So, should not make a mistake here. The 4 landmarks I will repeat once again for you. The first is the Z line. Now, the Z line, you can ask me, does all Z line correspond to lower esophageal sphincter? No. Special situations like the Barrett's esophagus, where there is a migration of the mucosa, the squamous columnar junction to cephalad. There you won't get the Z line corresponding to the lower esophageal sphincter, but otherwise the Z line, the transition lining from the smooth esophagus to the rugal folds, the external landmarks like collar of Helvetius and the gastroesophageal fat pad are all the landmarks to identify the lower esophageal sphincter high pressure zone. And with this, we'll briefly see about the arterial supply, the venous drainage. The arterial supply, to be specific about the arterial supply, the cervical esophagus, the thoracic esophagus and the abdominal esophagus we'll see separately. The cervical esophagus, the main supply is from the inferior thyroid artery, the esophageal branch of inferior thyroid artery, which arises from the subclavian artery on the right side and from the thyrocervical trunk from the left side. And in the thoracic part of the esophagus, receives blood supply from the aortic branches, aortic esophageal arteries. These are the aortic esophageal arteries. The left and right bronchial arteries gives rise to the esophageal branch, the intercostal arteries, and sometimes the descending branch of the inferior thyroid artery, as well as the ascending branch from the inferior phrenic artery. These are the arteries which supply the thoracic portion of the esophagus. Now, coming to the abdominal part of the esophagus, again it is supplied by the left gastric artery and some branches from the paired phrenic arteries, that is the inferior phrenic arteries. Now, all the arteries which supply to the esophagus, they terminate in a fine capillary network just before they penetrate the muscular layer, and then after penetrating the muscular layers, the capillary network continues the length of the esophagus within the submucosal layer. And this is in short the arterial supply. Coming to the venous drainage, the venous drainage parallels the arterial vasculature. Now, coming to the cervical part of the esophagus, the submucosal venous plexus drains into the inferior thyroid vein, and from the left side, again it drains into the subclavian vein. And coming to the thoracic part of the esophagus, the submucosal venous plexus, this constitutes of the superficial venous plexus and the venae committens. It drains into the azygos vein in the right side and the hemiazygos vein in the left side, and some intercostal veins also drain into the azygos vein on the right side. Coming into the abdominal part of the esophagus, the venous drainage, the systemic supply, which we saw the arteries supplying the abdominal part of the esophagus, the same the venous drainage parallels those, like the left and the right phrenic vein part constitutes the venous drainage of the abdominal part of the esophagus. Some part of the esophagus drains into the portal circulation also, draining into the left gastric vein, that is the coronary vein, and also some into the short gastric veins.